Nation Publications Limited, Times Group, and Zodiac Broadcasting Station. We are dealing with the state of corruption in health facilities, and these are the media organizations working in consortium who broke this news. So we want to learn from them, perhaps getting more details on how they did the story, of course, coming up with evidence that will help us to engage further with the stakeholders that will be coming as we continue with our inquiry. But before we go into details, we start with introduction from that far end.
Thank you very much. Good morning. Through you, Chair. I'm Falesi Deborah Mpo Hamoyo, representing the people of Chitipa North Constituency.
Through you, Chair. Good morning, everyone. My name is Aida Nchenga, representing the people of Doha West. Thank you.
Through you, Chair. Good morning, everyone. I am Hastings Kajomba, representing the people of Choro Konjeni Mangunda constituency. Thank you.
Through you, Chair, I am Mwesho Alexander Chirikuntima, representing the people of Ncheu Central East, and I'm a member of this committee.
Good morning, Honorable Chair. I'm Deus Kumba. I represent the people from Mchinji Southwest constituency. Thank you.
Good morning. Right Rev. Alex Mahoe is my name, representing people of Mzimba Sorola constituency, and I'm a member of this committee. Thank you.
Good morning, Chair. I'm Jeremiah Jumbe, coming from the people of Blantyre Southeast constituency.
Morning, Chair. Through you, my name is Mackenzie Nkwazi Chipalamoto. I'm representing the people of Nkatabe North, and I'm a member of this committee. Thank you.
Good morning. Through you, Chair, my name is Urunji Fikani Nyirenda, representing the people of Mzimba Perekezo constituency. Thank you.
Morning, Chair. I'm James Mpunga, representing the people of Zomba City South constituency.
Good morning, Chair. Robin Kanyama is my name, representing the people of Mangochi West. Thank you.
Good morning, Chair. My name is Chance Muntari, coming from Chitipa South. Thank you.
Good morning. My name is Maureen Chifundo Seolachira. I represent the people of Mwanza West constituency, and I'm the vice chairperson for this committee. Thank you.
Through you, Honorable Chairperson, I am Sunge Kalumo, Parliament Secretariat.
Good morning, Chair. I'm Endless Nyale, Parliament Secretariat.
Good morning, Chair. I'm Judith Marua, Parliament Secretariat.
Thank you, Chair. My name is Mandela Gomeza, MP from Ncheu North.
Thank you very much, and my name is Anthony Masamba, Chairperson, Parliamentary Committee on Health. May I take this opportunity to hand over to the stakeholder for you to introduce yourself.
Good morning, Chair and the rest of the committee. I'm Edith Kambalame from the Nation newspaper.
Good morning, Chair, and good morning, members of the committee. My name is Gordon Matonga. I'm with a platform for investigative journalism.
Thank you very much, honorable members. Here is our stakeholder. We'll start with a presentation from platform for investigative journalism. Before we go into substantive matters, feel free. This is an engagement where we want to listen to them, gather evidence, learn more details about the corrupt practices taking place in our health facilities. Thank you very much, and over to you.
Thank you very much, Honorable Chairperson, and good morning once again, Honorable members. As I said, my name is Gordon Matonga. I work with a platform for investigative journalism. I'm one of the managing partners at PIJ. But when I'm speaking this morning, I'm also speaking to you as a coordinator for a program called the Continued Journalism Education. Let me start with the Continued Journalism Education. The Continued Journalism Education was a project which was being supported by the British government through a program called TSOC. This is an anti-corruption program that started around 2018. They also do support law enforcement agencies, the SCB, the Financial Intelligence Authority, and other governance agencies such as the ODPOD, the Office of the Director of Public Declarations of Assets and Liabilities. They also support the Director of Public Prosecutions and other agencies that are involved in the fight against corruption. So the CJ, the Continuing Journalism Education, was conceived to also support investigative journalists in order for them to be able to come up with stories, produce stories that unearth corruption. So it's from this background where you see me making this presentation. I'm one of the coordinators for the CJE program, alongside my colleague Dr. Jolen Taba, who works for the University of Malawi. And from investigative journalism, we are just one of the organizations, member organizations of the CJA programs. The CJA program constitutes various media houses in Malawi. These include Nation Publications Limited, Times Group, Zodiac Broadcasting Station, Africa Briefs, Midge FM, Zimwe Community Radio, and Capital FM, and others. So their members, selected journalists from these organizations are part of the CJE. So this is a continuous training organization where journalists will meet from time to time to discuss what stories can we pursue and how can we support one another to be able to do those investigative stories. So that's what the CJE is all about. Just a bit about PIJ. PIJ, we are a non-profit organization, so we are not a commercial entity like Nation or Zodiac. We are donor dependent. We apply for grants, and that's how we support our operations. So why is the CJE existing? Mainly it's because of the media landscape that we operate in the country. The CJE looked at the fact that most of the media houses in Malawi do not have enough resources to be able to support the training of their journalists, to be able to carry out investigations. So we decided that apart from the work that they are doing to support their journalists, we should also come up with this mechanism where we can train continuously journalists and we can be able to provide from time to time some resources to do investigations. So the media landscape in Malawi constitutes mostly commercial media houses. So organizations like Nation, Times, these are purely commercial media houses. Their aim is to make profit. But also we have public broadcasting, MPC, Ministry of Information. And if you look at that kind of landscape, you see that there are a number of challenges that make sure that these organizations cannot succeed alone in terms of conducting investigative journalism. That's why we came up with the CJE program. So some of the challenges, as I indicated, most of the media houses have limited resources for training, and they have very limited resources to conduct investigations, and there is donor fatigue to support direct media houses when it comes to doing their work. Most media houses do not have specialized investigative units to conduct investigations. And most of the journalists are poorly paid. I'm sure honorable members, you have encountered this issue from time to time in your interactions as politicians, but also from other walks of life. And because the economy is so small, the media houses are struggling to make ends meet, and for them to invest in investigative journalism becomes a challenge because we are already struggling. And among very few rich Malawians that are doing well in this country, very few are interested in supporting governance of this country, particularly supporting investigative journalists. So we had to look for resources elsewhere to support investigative journalism. And there's also a culture of secrecy that hinders work of investigative journalists in the country. So, honorable members, I'm just giving this as a background to explain how we came up with this consortium to do this this investigative work. I will not dwell much on the aims, but the objective now was to turn the small cohort of investigative journalists into very specialized media personnel who can do top-notch investigations and that could be able to unearth corruption and support anti-corruption activities that law enforcement agencies are conducting. The aim again was to continuously mentor a small cohort so that it can become as specialized as possible and equip them with skills that could enable them to do impactful investigations. So our activities, we used to meet regularly because now we don't have funding, so we have stopped, but we used to meet regularly at 3 months intervals, physically meet and discuss stories, what we used to call story labs, looking at what kind of stories can we pursue in the country and brainstorm together, coming from different media houses on those stories. And then we used to have media events around anti-corruption. For example, on the 12th December, it's International Day for Anti-Corruption. So we used to meet and come up with an event, perhaps maybe a media show or a talk discussion at a venue where we would invite different stakeholders, like on a panel discussion and discuss issues around anti-corruption. So let me now go back, honorable members, to the issue that has brought us here, which is this particular investigation that we conducted. The investigation was called Pay Up or Die. That was the headline that we came up with after the investigation. So how did it commence? We had been discussing last year during our previous quarterly meeting about what possible stories could we conduct. And one of the trainings that we had that day was on collaborative journalism, which is media houses coming together to do an investigation. And after that training, we were all inspired to say, okay, we have been doing trainings for a long time, but now we have been challenged to do a collaborative project, and how can we go about it? So we decided that, to come up with a number of ideas that we could immediately pursue. And the most interesting idea that we decided that we should immediately implement was the heavy bribery investigation. Honourable members, you may know, you may have met family members or constituents in your area who have been complaining about going to the hospital and not receiving treatment or overstaying on the hospital queue. And that was also a similar experience of most of the journalists. Almost every journalist that was in the room was able to say, okay, I know someone who had an experience at a maternity wing. They even some had lost some relatives or had lost a newly born baby because of some hospital staff demanding a bribe or not giving them enough attention because they look poor and they may not be able to pay a bribe. So we said, okay, we know these things, but how do we ensure that we get evidence of that kind of discussion? So we decided to form a team to do this investigation, and that team was to come from all the major media houses that are in the country and are present as members of the CJE. So we came up with the coordinators, one from Zodiac and one from PIJ, to coordinate the whole investigation. And we decided that for this investigation to be able to project a national picture, we need to do a nationwide investigation. So we deployed our teams across the country. So one team went to the Northern Region to do an investigation at the Zuzu Central Hospital. And another team went to Nkatabe to do an investigation at Likoma and Nkatabe district hospitals. Then we also deployed a team to the Central Region, which focused on the Kamuzu Central Hospital. And we deployed a team at the Queen Elizabeth Central Hospital, focusing on Queen Elizabeth, and a team at the Chiladzulu District Hospital to focus on Chiladzulu District Hospital. So we wanted to have not only a nationwide picture, but we wanted to have an understanding of what is happening both at the Liflo Hospital level, but also at the district hospital level. So that when we talk about challenges that Malawians are facing, we are not only talking about challenges that people in the cities are facing, but we are able even to go back to as remote area as Likoma and explain that this is what our fellow citizens in Rukoma are facing. So the methodology that we used was mostly to first send the reporters as the undercover reporters. So when I'm talking about undercover reporters, it meant these reporters embedded themselves in the hospitals as if we were patients, ordinary Malawians that are trying to access public health services. They did not identify themselves as journalists when they first went to the hospitals. So one, we needed to understand exactly what was going on, and we needed to see for ourselves what was going on. So in all the hospitals that I've mentioned, we deployed undercover reporters, and for us to be able to satisfy ourselves that the testimony that will come there is not forged, is not something that can be challenged, we deployed a pair of teams, not only one person and come back and say, this is what I made. We deployed more than two people at each hospital so that they can come back and report with something that we can be able to defend. So after then experiencing what we experienced, after speaking to hospital staff, patients, then we were able to come back and then start doing interviews formally with the authorities, hospital directors, and others that we are mentioned in the investigation. As a way of ensuring that our evidence was watertight, we recorded the interviews that we had being done and the undercover by our reporters. So I was reminded by the chairperson earlier on when I met him in the corridors that we need evidence, not just speech, but I had not collected all the recordings, but it's my undertaking, honorable members, that we will send you the recordings because we have preserved them for the benefit of the committee. So we'll be able to do so once we have done with this session. So we use what we collected, the evidence of the reporters, a testimony of patients, testimony of health personnel, then to come up with the findings of the investigation. Then we came up with a publication date. Once we had drafted the story, then we engaged the editors of the various newspapers, the major newspapers and radio stations and TV stations, to show them the draft of the story. Once the editors were satisfied with the story that had been produced, then we come up with a publication date. That was, I think, Sunday. I've just forgotten the date. I think it should be February 15, and that's when the story was simultaneously published on all the major platforms in the country, the newspapers and radio stations. And honorable members, I'm happy that I can zero in on the key findings of that investigation as we publish them. So the key findings of the investigation can be broken down into 5 parts. And number 1 is the monetization of what is supposed to be a free medical care service. Throughout all the hospitals that we attended, there appears to be an invisible policy where primary health care, which is supposed to be free, is being sold by hospital staff. And this is an informal policy that appears to be implemented in almost all the major hospitals that we visited. And what is alarming is that includes even the most life-saving treatment. Honorable members, this would not have been a major concern if it was only maybe for sale of bandages or for Panadol, for you to access Panadol. But what alarmed us most in this investigation was that life-saving treatment, for example, a woman who is supposed to undergo cesarean treatment or supposed to receive any antenatal support, is being asked to pay for treatment that is supposed to be free. Very severe patients. We had a picture which we published as part of the investigation with a woman who was battling for her life. She was lying on the hospital floor and they couldn't treat her because she hadn't paid someone. And other patients were being prioritized because they are well-to-do. And again, I think another important point when it comes to this monetization is that it's the issue of the widespread of a problem. It's across the board, the geographic areas, from referral hospitals to also remote health services. The bribes rates could range from as little as 4,000 to as high as 260,000. So one of members, I think the point is, if you look at our economic statistics, the average Malawian lives within $1 a day. It means their total income in $1 is around 2,000 Malawi kwacha or 2,500 Malawi kwacha a day. And when we go to a hospital, this poor person is being asked to pay 4,000 kwacha, which is a lot of money for someone in the village. But even for someone who has a stable income, to be asked to pay 260,000, for example, to save your pregnant wife, I think it's a lot of money. We at the Kamu Central Hospital, we found families that were waiting to have surgery, being asked to pay as much as 200,000 to get surgery where they treat the injured at the orthopedics and neurosurgery ward, commonly known as the Lions ward. So we found a patient who was told that they could not access services because they had failed to pay 260,000 for surgery, which is supposed to be a free service. But what the health workers are capitalizing is the fact that we have a huge backlog of patients that want to access services. And because of that backlog, they create a scenario where people are desperate. There's desperation among the patients, and that forces them to try to pay a certain amount of money in order to get ahead of a queue. So that's the scenario where the health workers are capitalizing on. Additionally, the second major finding of investigation is that this is not a spontaneous event. These are coordinated activities within the hospitals. So you find that there are chains, there are cartels within the, if I can use that language, there are cartels within hospitals that know whom to call, who are the people to do certain services in order to, for them to make money. There will be specialists, for example, they will know that they will not be involved in bribery. And if a patient goes and asks for certain services and that specialist is there, they will deliberately ignore that specialist and call someone they know is part of their system that will force this patient to pay something. So we have to be very clear. It's not every healthy personnel that is involved in this system. There are many healthy personnel that are doing wonderful work, that are supporting Malawians, that are going outside even their scope to support these Malawians. But there are a few bad apples that are part of this system, and those are the ones that we are referring to. So again, to show the systematic way this is being done, we found that it starts even from a guard at the gate who initiate the corruption, who ask questions to patients they are not supposed to be asking. Patients are supposed to be interacting with doctors, with the clinicians, but we find that a guard is asking details about a patient's conditions in order for them to initiate a process of corruption. Once the corruption has been initiated, the bribe will be then shared to the rest of the system. Another key finding is, as I alluded to, is the neglect. People will notice patients that are alive at the hospital that are in dire straits, that are struggling, but they will be deliberately ignored in order to force the family to pay a bribe in order for them to get access to the health services. One example was at Choro District Hospital, where this was actively used, the tactic of ignoring patients until the patients are desperate enough to ask for someone who can get a bribe and get them the treatment they want. Another key finding was that the hospitals were supposed to have oversight to stop all this. There are supposed to be mechanisms. For example, there is the initiative of hospital ombudsmen or ombudswomen who are supposed to be deployed in hospitals in order to ensure that health workers are adhering to the code of conduct, and the complaints by citizens are listened to by the facilities. But what we discovered through our investigation is that while this system on paper is working, on the ground, there's no one to protect the citizen at the hospitals. There's no one listening to the citizens. There's no routine checks, for example, to see that no bribes are being taken and no abuse of any sort is happening. So it's the absence of implementation of a supposed sound initiatives that is lacking, and that is also facilitating the bribery at the hospitals. One shocking finding was that beyond the living, even the dead are also being victimized. At Chiradzulu District Hospital, for example, we found that families were being asked to pay for between 20,000 and 50,000 without any receipts by mortuary attendants for facilities like to wash, embalm, and release bodies for their deceased relatives. There are certain services that are supposed to be charged by the mortuaries, but those are supposed to be backed by receipts. One, we found that the normal services, the acceptable services that are supposed to be charged, receipts were not being issued. And secondly, there were additional costs that were being charged that were not part of the mortuary services that are supposed to be paid for. Again, I think independent oversight, in terms of the hospital administrations, again, we find that there was there was disregard in terms of their oversight. Most administrative officers are supposed, by the mandate given to them, are supposed to be the ones policing their health personnel. But from our investigation, it appears that the administrative officers, the hospital directors, are too preoccupied to do oversight work for the facilities. So again, that led to the situation that we are observing. So those were the key findings from the investigation. And just again to quickly wrap up, there was monetization, there is collusion, and there is the weaponization of neglect of patients and the lack of oversight. And those are the four key findings. In terms of impact, honorable members, we are grateful as the members of the CJE that as journalists, one of our biggest frustrations is that we do a lot of work investigating a number of issues, but when we publish these investigations, most of the times there's no impact as we desire or as we expect. But for this particular investigation, honorable members, and again, I think this session of the committee is a testimony to that, there's been tremendous impact, and we are happy and grateful as journalists for the first time that we can be able to point to that kind of impact. Number one, I think what we observed as impact was the great public anger. Immediately we published this investigation, social media was all about this investigation. And it showed that Malawians really care about these issues, but also Malawians were able to resonate with what we were saying. When we talked about the findings, people were able even to give more testimonies about what is going on, more than what we published. So that was something which we observed. Secondly, the executive branch of government moved very fast to address this issue. You may recall we published this story on Sunday. By Monday, the Minister of Health had already visited the KSH. And just to complement what we did, the Minister of Health did not go in his official vehicle with over pump. She went there and again did her own fact-finding mission, and also discovered some of the things that we found. She even said she had been given evidence of members of the hospital demanding bribes through text messages. So again, that was for us very gratifying because of that kind of impact. The public protector, the Malawi ombudsman, also announced immediately that we are going to investigate this matter. And we saw immediately the Malawi Human Rights Commission again also announcing that we were launching an investigation into this very matter. And as I earlier alluded to, this health committee immediately also signaled that it was going to be investigating this matter, culminating to this day where we are having this conversation. And we are grateful to the members of the committee and its leadership. But the most consequential impact came from the highest office on the land. The president, within a few days, I think 3 days, announced an executive order, 2 executive orders. The first executive order banned all healthy personnel from owning and investing in private hospitals. This was directly coming from one of the findings of the investigation that some of the specialists, doctors for example, would divert patients from public hospitals to their own private hospitals. So the president decided that to address this supposed miscarriage of justice, the health personnel should be banned from owning private hospitals, or they should invest if they invested in disinvest if they invested in any public health facility. And also again, the president, the second order, the president ordered that from now onwards, if any public health official, any public official was found to be soliciting or accepting bribes, they should be summarily fired and arrested. Honorable members, this was very consequential because it showed that the whole government machinery had moved to address this issue. We are still waiting to see the impact of those investigations, the impact of the decisions that have been made, because I think it's one thing for us to make statements and move on, and it's also one thing for the media to just release an investigation and move on, and then things quickly go back to status quo as if nothing ever happened. So we are all hoping that all the stakeholders, the media, Parliament, the Ombudsman, the Human Rights Commission, the President, and the Minister will continue ensuring that we are monitoring the situation and the recommendations that are going to be made by this committee and others are taken fully into action. Honorable members, let me not prolong the presentation, but I think I can stop here and allow my colleagues also to come in if need be. Thank you so much, Chairperson and committee members.
Thank you very much, PIJ, for that elaborate presentation. It's shocking that services that are supposed to be free are being monetized. Neglect by healthcare workers and so many issues hindering the access to quality healthcare services. Before we allow members or before we go into plenary, we also have Nation Publications Limited, just to complement what PIJ has presented. Thank you very much. Over to you.
Honorable Chairperson and honorable members, my colleague has provided a very comprehensive
Point of order. PIJ, would you consider switching off your mic?
Yes, so honorable Chairperson and honorable committee members, I will not, I think, belabor the point. My colleague has provided a very comprehensive report, and I think it covers very well the the findings of the project and also the impact of it. Maybe I could just add a little bit on some recommendations for consideration by Parliament. So respectfully, we submit several issues this committee may wish to examine. Possible considerations may include, first of all, strengthening independent complaints mechanisms. I think, as my colleague has explained, we've got those mechanisms in place on paper, but as we have seen, implementation is a whole different thing altogether. We would also like to have the committee consider anonymous reporting channels for patients and health workers, and stronger whistleblower protection, transparent complaint outcome reporting, targeted integrity audits in facilities, and improved queue management and traceability systems in public health facilities. We also wanted to emphasize as NPL that this investigation does not conclude that all health workers are corrupt. As my colleague says, there are many health professionals that are doing a good job, and we also acknowledge that many health professionals operate under challenges, including staff shortages, heavy workloads, resource constraints, and difficult working environment. However, resource limitations alone may not fully explain recurring allegations involving unofficial payments, preferential access, and organized facilitation practices. And I think we also have to remember that these are public health facilities that are running on taxpayers' money. So the taxpayers have already been taxed on their earnings, and when they go to access those services freely, but when they go on the ground, they are also asked to pay more. Chairperson and honorable members, our investigation ultimately raises a fundamental question. When a Malawian enters a public hospital seeking free care, what determines access? Is it medical urgency or the ability to pay? So we hope that our contribution assists this committee in its inquiry and to strengthen accountability, public confidence, and equitable healthcare delivery. Thank you.
Thank you very much. That's a very fundamental question. Is it the ability? Is it the access or the ability to pay? Whether someone has money or it's just an access, right to health. We also have in our midst, Times Group. Do you want to compliment?
Thank you, Chair. Sorry, I've come late because the letter which you unveiled us went through to Blantyre, so I didn't know that I was supposed to come here. So I'm ready for any questions. Thank you so much.
Thank you very much. Apologies for that. I think Zodiac will also be joining in late. Their staff member is on his way coming to this inquiry. Honourable members, time for plenary. We have heard the presentation from the consortium members. So they did the investigation in Zuzu Central Hospital, Katabe, Rikoma, and others. So it's primary health care that they had targeted. Of course, they haven't told us that they scaled down their investigation to health centers. They only targeted district hospitals and referral hospitals. Of course, I think they will tell us why. Plenary, questions, comments? Yes, we start with Nchinji West. We go to Blantyre City South Lunzu. Then we go to Chitipa South. Then we end with Ncheu Central East. In that order, please.
Thank you very much, Honorable Chair. And through you, let me thank our delegation. They've done a good job, the journals. This is quite commendable. And we would wish this collaboration should continue in the fight for our people's welfare, especially in the health sector. Honorable Chair, I've noted that the investigation has mainly centered on the provision of medical care or perhaps seeking services in our public hospitals. But I would have loved if perhaps they would have gone further in terms of doing some investigation on the drugs. That's the pharmaceutical aspect. I really wanted to find out whether they went deeper on that aspect, and indeed, if they found some drug beverages, and perhaps if there was some evidence or documentation, recordings, photos, and what have you. But otherwise, for now, let me commend the journalists for the job that they have actually, that has actually been done so well. And indeed, in terms of the impact, I think all of us were actually, we jumped on our feet and look at the most highest office on the land. Obviously, the aftermath of it, we're yet to see, but definitely the medics are on their feet. Definitely they'll be on the lookout. I submit, Honorable Chair.
Thank you very much. Quite commendable job by the consortium members, but the question is, what about the drug theft investigation? That's the question from the people of Unchinji Southwest. We go to Blantyre City South Runzu.
Thank you, Chair. I have a few questions. One, thank you so much for the good presentation, and I want to commend the team for the great investigation that you did. Being someone that has worked in the media before, I do understand the challenges that media in Malawi do face, especially the funding and the resources. I think a lot of NGOs, organizations will always sideline it and, you know, paint it as if it's something that is not very important. But I think with this investigation, it does really bring out the importance of what journalism and media can do in bringing out such cases. So I want to thank you so much for that. I wanted to ask, did you consider the naming and shaming strategy as well, so that we can also, I mean, I wanted to understand, do we have any hospital staff or the guards or, you know, all these people that are working in this institution that are already under investigation after your report was published? And also, after your report was published, do we have any evidence, such as receipts and testimonies that you have, that you can also provide to the committee, that we can also, you know, have a peek and pin it as important, rather than just something that is written as a document, but something that can have substantial evidence for us as a committee to also be able to help. And I also wanted to ask my last question, Chair. I also wanted to ask if you have evidence of medicine being curtailed or, you know, being sold or being taken to other private institutions. If you have any photos or something like that, that we can also have evidence on that. Those were my few questions, Chair. Thank you very much.
Thank you very much. So, Blantyre City South Lunzu, naming and shaming of the culprits involved. Just to inform you, the people of Blantyre City South Lunzu, the consortium has informed us that they will be providing us with all the evidence that they have, that they collected during the investigation. And the other question about the drug being channeled to private institutions, you may also choose to speak on that one, but I know that that was not your scope of investigation, so you choose whether to take it or not. We go to Chitipa South.
Thank you so much, Honorable Chairperson, for granting the people of Chitipa South constituency to basically ask two questions to our stakeholder. Prior to doing the same, let me also join my colleagues to congratulate PIJ for a wonderful presentation. Chair, the people of Chitipa South would like to find out how long was this study, if I may call it a study, like the duration that the undercover journalists were staying at a particular facility. This is important in my view, because if we're able to get such kind of revelations, we may want to know how long this exercise was done. That may inform us further. Secondly, is a concern on what the presenter mentioned during his introduction, that CJE is basically receiving funding from a certain organization. I didn't get it. It's from the British. So these guys are doing a good job. With the donor fatigue, assuming that the donor decides to pull out, how do we move forward as a country? Chair, I submit.
Thank you very much. I think the last question should be ably handled by this committee. How do we help the consortium? Because they have already told us that they do not have funding currently. And your first question is, how long was the study? Was it the study itself, or you wanted to appreciate how long did the investigators stay at the particular health facility? What was your question for the benefit of the presenters here?
Exactly, Chair, like I've said, I wanted to find out how long were the investigators staying at a particular facility. For instance, they said they were at Kamu Central Hospital. How long were they at Kamu Central Hospital for them to find out what they found out? Because probably what they found out was because of the time that they had stayed. Probably if they stayed longer, they could have found even more than what they found.
Thank you very much. We go to Ncheu Central East.
Thank you very much, Honorable Chair, for recognizing the people of Ncheu Central East. First of all, allow me to thank for the comprehensive presentation. This is the eye-opening for the government officials to end the malpractice. Thank you very much. Keep it up. Secondly, however, there is another syndicate at the OPD by guardians. If the guardians are at the hospital, especially central hospitals, government hospitals, they are there for a month, almost each and every day. They go for prescriptions at the outpatient department. What they do, if they go today for a prescription, they present as if they are sick. Next day, they will go again and strip off the paper which was used yesterday for the doctor who prescribed that paper. They do that almost every day. It's a syndicate which you need also to investigate. And how should it be ended up? Thank you.
Thank you very much. That's the question from the people of Ncheu Central East. I think we need to end here for this round of questions. May I hand over to the consortium members to tackle those questions? Some are the comments, some are the recommendations. So you may wish to tackle the questions. Over to you.
Thank you, Chairperson. Allow me not to go in the particular order where the questions were presented. I will answer as I recollect some of the information. So my colleagues also will come in from time to time. So the first question I will start with is from Blantyre South, City South, Lunzu. Did you consider naming and shaming? So as you may recollect, honorable members, we are a different news organization with different editorial standards that we are operating on this investigation. So we decided that for us to have greater impact, but also to be able to to convince the editors that we could do a nationwide investigation. We should do as much as possible try to avoid naming and shaming, because naming and shaming brings the question of defamation. And we needed to, and the threshold for the editors for evidence is more difficult when it comes to when you have named someone than when you are just naming a facility. So partly, we were having that in our mind when we consider that if we were to convince all the editors of all the newspapers to publish, we should do only name where we have concrete evidence. And in some certain circumstances, we use the word of mouth. For example, when we record a guard saying that I can connect you to a certain specialist, we avoided naming the specialists because we did not have all the evidence that we needed. And that takes us back to the issue of the time frame of investigation, because we did not have all the time. And again, we still wanted to report as extensively as possible in terms of areas that we could report on. So we considered it, but eventually we decided that in most of the cases we could still report and portray the extent of the investigation without zeroing in on an individual. But in terms of follow-ups, the investigation provides very clear guidance on how to identify the culprits that were involved. For example, if you mention that at a certain hospital, a specialist was demanding certain amount of money, we are doing so to protect ourselves legally, as I mentioned earlier, from defamation. But you can go and identify that at a certain hospital, there was only one person who is a specialist, or there are two who are specialists, and you can be able to zero in on the particular period and say, during this period, who are the people who were in charge? The same things apply to guards and other people whom we are referring to in the investigation. Do we have evidence such as receipts, audios? Yes, we have evidence that we have accumulated, and as the chairperson alluded to, we will share the audios that we recorded during undercover reporting to the committee. In terms of medicine that is being stolen from the hospitals, I think it's the chairperson who might have hinted on this. We wanted this investigation mostly to focus on the bribery, but we recognize that this problem is there, and even in doing this investigation, we could hear reports about issues of drugs being stolen from hospitals. But because this wasn't the scope of this particular investigation, we reserved this matter for further activities in the future. But it's certainly something that we are definitely interested in. And also, again, just to appreciate the information that has come from honorable member from Ncheu Central East, because that for us now becomes a tip, and that's something we can work with and start an investigation on. So whether we do that kind of investigation as the independent organizations or as a consortium again, it's up to the team. But thank you so much. That has been well noted, and we can be able to work on it. Again, just on the question of drugs, we didn't do much focus on drugs, but in subsequent investigations as PIJ, we have done an investigation around drugs, which one of the members would like your committee again to look into. We did an investigation focusing on the supply of expired insulin to 5 public hospitals as a follow-up to this investigation. There's a private company which we have named, Galaxy Pharmaceutical Limited. I know this is not subject of this inquiry, but just as an addendum, because of the question that has been asked, this company supplied to public hospitals expired insulin, which was dangerous and endangered many lives. At Queen Elizabeth Hospital, Kamu Central Hospital, Malawi Hospital, Zuzu Central Hospital, and the Central Hospital, and Malamulu and Palombe district hospitals as well. This issue, why we feel is very important for the committee again to look into is because prior to this supply of drugs, the same hospital in 2013 was disbanded, was closed by the Pharmacy and Poisons Board, now trading as the Pharmacy and Medicines Regulatory Authority, for supply of antibiotics that are suspected to have killed 5 infants at Zimba District Hospital. We have published this investigation, and I'm referring to it because of the context of the question that was earlier asked. And the medicine, the expired insulin that was supplied to the 5 hospitals was stolen from Queen Elizabeth Central Hospital. And again, that's public resource, and I think it should also interest the committee to look at your pressure, to look at this particular investigation that we did as well. So that's it in terms of drugs. Yes, we're interested and we'll continue looking into them as individual organizations, but also as CJE resources permitting. There was a question from Chitipa Saf. How long was the investigation? There are 2 aspects. The actual investigation itself took 2 months, planning and execution. But in terms of how long we are staying at a particular hospital, it depended on the nature of the issues that we are identifying. In most cases, we are staying there at the minimum for a day. At the maximum, we would only spend as 3 days. There are places like Likoma where the stay was determined by transportation. There are places like Chiradzulu where none of our team is based there, so it was because of resource constraint that we had to go, maybe spend a day, a night, then come back without staying there for more than 2 nights. So we are resource constrained. But for KSH, Queens, and Zuzu Hospital, where we have teams that are based there, we are able to go there maybe for the whole week and collect evidence and come and report on what we are discovering. Yeah. How long can we continue without funding? Honestly, we can still be able to collaborate. There are media structures like MISA Malawi, Media Council of Malawi, that could, if we could have an initiative within them, they can be able to collaborate media houses. But to fund investigations, we need a partner to be able to do so. And unfortunately, for investigative journalism, it requires resources. We need to travel, we need to spend time there, food. We need to take time to do these things. So it's an element of resources that we need to interest someone to come back. The TSOC program, which supported this investigation, no longer supports us, as I indicated, but they have indicated that they might come back and support us. Hopefully they will do so, but if we are not able to interest them to continue funding us, then we should be able to work with other partners. And I think the committee, if we can be able to put a word for us to any institution, I think it will also help us, because that comes up with a lot of goodwill if such an important committee like yours gives us a recommendation. So we really appreciate that sentiment as well. I don't know if I've skipped any questions, maybe.
Not really, but do you want to add more times or nation before we take another set of questions?
Thank you so much, Honorables. We just want to thank the tips that you have given us, and we are ready to roll out more investigations in as far as healthy facilities, corruption, drug privilege is concerned. Thank you.
Thank you very much. Mangochi West. Mangochi West, the people of Mangochi West.
Thank you, Chair, for the opportunity for the people of Mangochi West to interact with our consortium. As my fellow colleague has already done, I need also to congratulate for the job well done. But I have a number of interventions. Number one is that after you have investigated such issues within the named hospitals, did you had a chance to speak with the hospital management or any health authorities within the Ministry of Health, and what were their quick reactions about that? Number two, just because you have got a clear evidence about some sort of corruption being taking place, did the consortium reported the issue to some investigative agencies like the police or the anti-corruption bureau? And if so, what was the outcome? Number four is that when we are going into an investigation, we do have some of the suggested solutions which we want to get from there. Now, after publishing the story into the media and the impact, as you have explained, as a consortium, are you satisfied with the impact, or there is something which you wanted to have happened that wasn't being happened? And the last three, Chair, they have complained about the resource constraints, but that aside, does the consortium have an idea of taking the exercise to the health centers, so that that's where most of the poor Malawians get the health services? Do you have such idea that you can take the exercise to the health centers where the poor Malawians also, maybe they are meeting the same problems? Thank you, Chair.
Thank you very much. The people of Mangochi West, 4 questions there. Did you interview the senior management team, the Ministry of Health? And number 2, did you collaborate with the law enforcement agencies, perhaps Anti-Corruption Bureau and others? And then solutions, recommendations as a consortium. I know that NPL gave out some of the recommendations. Perhaps you may wish to repeat. And then health centers. Any plans of going to health centers? Nkata Benoth? Was it you or?
Yes, Chair. Yes, Chair. Even though some of the questions have been asked by my colleague, but I'm having one that maybe our consortium can give us some sight. That on the root cause, on the issue of root cause, after investigation, then we have to see the root cause. Low salary or budget shortage being used as a justification by those involved in corruption.
Thank you very much, the people of Nkata Benoth. So we did the investigation, or you did the investigations. What did you find out about it being the root cause of the corruption? Blantyre Southeast?
Thank you, Chair. After you have done your investigations, are you still there on the ground? Because I'm looking at the repercussions, the reactions from the health personnel, and the reactions from the management. Because he has said that, did you approach the management? But there is another way where the management will react at the health center. What happened after that? That's what I'm interested in. Thank you.
So reaction from the senior management team. We go to Zomba City South, and then we finish off with the Chitipa North. If the people of Zomba City South are not ready, we go straight to Chitipa North.
Thank you very much, CJP, for the great presentation. The outcome is good. I also wanted just to share, the rest have been said by other members. I wanted to check with you if you have further plans, like periodically, you still go back to the same hospitals just to measure the impact after the investigations that was done and the publishment. Do you have plans that periodically you still carry out to monitor? Thank you.
So now we are giving you some responsibilities to work as monitoring specialists now. And then people of Zomba City South, finally.
Thank you so much, Chair. And through you, I should thank PIJ for the wonderful job that we are doing. And I think, Chair, this is what journalism should be doing. Instead of just reporting, no, Arsenal are winner, or whatever. We need the serious stuff. So I think this is what journalism should be doing. So congratulations, Bwana Matonga and everybody else that side. The heading, when I read the newspaper, pay up or die. As a medical person myself, I felt very uncomfortable because that heading, I know you wanted to sell the newspaper, but it gave a picture of saying if you go to a hospital, if you don't pay up, definitely, mortuary, last office. But I'm happy that you and Betha, Edith, you also cleared the air to say, no, there are good people there. Most of us have good people in the hospital. So as a medical person, I felt very bad. So I'm happy that you have clarified that there are good people doing a fantastic job, but there are bad apples, and we need to uproot those bad apples. So I thought I should be also very happy that you have cleared it. Secondly, you have also reported before this investigation, the impersonators in the hospitals. Some people put on stethoscopes or the white coats pretending to be doctors. And because they're in the vicinity of the hospital, people might also mistake them to say these are medical people. So I also just wanted you, maybe as you move forward with further investigations, to be able to separate impersonators. Those are not health people. They are thieves. They're also stealing from our people, from the patients. Let's separate them. Because if you take that story and put it in the newspaper, people say, but most of us are good people. So I thought maybe in future, you can do the investigation, but be able to be sure that we are talking about a health personnel and not necessarily the impersonators, because the hospitals have been infiltrated in the Antogubanga Damenage. Finally, I wanted to also agree with whoever has spoken, is it Ncheu or is it Chitipa, that we needed these cartels to be put out there. Because if it's a cartel, just reporting like that without naming them, people still be victimized in the future. Even now as we are talking, people are being victimized because the cartels are still there. So to some extent, we get a name and shame. These cartels should be caught so that we clear our hospitals. Thank you, Chair.
Thank you very much, the people of Zomba City South. So during your presentation, the consortium members, you had indicated that the backlog of these cases might have motivated the corrupt practices at the health facilities. Did you find out what made these backlog cases? And then you should also appreciate the fact that some of the health facilities that you targeted have paying and non-paying wings. Which ones did you target? Did you differentiate? Right. Thank you very much. For now, you can take those questions.
Thank you so much, Chairperson and committee members, for the questions that you have given us. I will start, and my colleagues would also come in at any point. The first question came from Mangoji West, whether we spoke to hospital management. As a standard journalistic practice, after every investigation, we confront those that we are going to report on. So if you're going to report on a hospital, for example, KCH, the confrontation will involve interviewing the leadership of KCH. So for every major hospital that we reported on, we spoke to the leadership of the hospital and indicated to them that these are the findings Can you tell us what you know about what is going on at your hospital? What are you doing to stop this, this practice and so forth? So we did at that level. Then we also spoke to the Minister of Health. We indicated to them that these are the findings. Before we publish, we'd like to hear what is the ministry doing to ensure that this stops. What measures have we put in place? And what are you going to do now that we have given you these findings before we publish? So that when we are publishing the story, we should also be able to say, these are the findings, but the Minister of Health says is going to do so and such to avoid this continuing happening. So we did engage the ministry and the directors of the hospitals at that level before the story was published. And after the story was published, there was a lot of engagement again, unofficial engagement with the PSs for the ministry, at some point the minister as well, but also officials from State House prior to the President's executive order. They were interested to find out what process did we go through to come up with the findings, and just to get other details as the committee is also asking. So there was that kind of engagement, sharing of information in terms of what had happened. In terms of engaging law enforcement, we are good public citizens, but we have to also ensure that we remain journalists. Our job is to bring these things to public attention. But it's not our job to report people to law enforcement. But if law enforcement or any organ of a state decides that they should invite us to engage us on these public issues, we will not shy away from that responsibility because we are citizens. We have to be able to help our country. The same way we have appeared before the committee, if SCB decided that they wanted to get more on this issue, they could have engaged us as well. As the CJE, we invited the Director General of SCB to one of our meetings shortly after the publication of this story. Unfortunately, I think because of miscommunication, he had indicated that he was going to appear, but later he wasn't able to appear. And unfortunately, that also coincided with the collapse of our funding. So we are not able to reschedule the meeting subsequently. But it was our wish that while we could not report as a complainant, we should be able to present the findings for the SCB to be able to take action. So, or to be able at least to acknowledge, to know that this is the findings of the investigation. But we know, honourable members, that SCB now is able to generate complaints based on what has been published by the media. Apart from just receiving complaints from whistleblowers or complainants officially going to SCB, SCB's internal mechanisms allow them nowadays to obtain any information that is public domain and internally generate a complaint. So it's our hope and prayer that SCB generated a complaint internally, and they are looking into this matter. But we are not aware at the moment whether they were able to do so or not. But we, again, I think just like other suggestions that have been made by the committee, I think we are duty bound to follow up on whether SCB, in particular, did generate a complaint internally, and they are investigating this matter. And that takes me to the other questions which we were asked by colleagues. What have you done to monitor the situation? Subsequent to the publication of this story, I think I didn't take pictures of these newspaper articles, but there have been a number of articles. We have been trying to follow up any action that has been taken by any authority or institution around this issue. We try to make sure that we publicize it. Even this appearance, we try to publicize it because we want to continuously keep everybody remembering that this is an important issue. And we follow up with the ministry previously, and we will continue to follow up with the ministry and the authorities to ensure that there is action being taken. And subsequently, I'm sure we normally don't talk about future investigations to avoid jeopardizing them, but I'm sure this is one area where we can possibly go back and investigate whether after what we reported, things have changed on the ground. Yeah. Yeah, maybe you can come in and have questions. Or... All right. In terms of, so we haven't deployed teams on the ground, but from periodically we'll be able to go and revisit the subject. In terms of impersonators at the various facilities, I'm glad, Honorable, you have mentioned, and I'm also happy to know that in the committee, you are one of the health personnel that have a lot of experience working in the health services. And I need to agree with you, the impersonators at the various hospitals. But for this investigation, we focused on the health personnel that we could identify that these are indeed public service officers and they are not impersonators who are just trying to scam innocent Malawians. In terms of satisfactory with the impact, I think that was a question raised by Nchinji Wastes, whether we are satisfied with the impact of investigation. I should say that we are generally satisfied with the fact that there has been a lot of interest in the investigation. We are satisfied with the fact that there have been those 2 consequential orders. It shows that government is moving, but there are several areas that need to be addressed, and that cannot be addressed in 1 day or 2. So our hope is that every institution that said we are going to investigate is indeed going to investigate the matter and come up with recommendations or actions that will then shift the situation on the ground. Until that is done, we can't consider ourselves, we can't consider that our job is done as journalists. Or we can't consider that the story has been impactful enough, because then the impact just becomes cosmetic. If we publish a story, people make statements, we make appearances like this one, and everybody goes home and say, okay, that story was impactful. But what will be impactful for us, and that what will ultimately satisfy us, is when we see that if we do another investigation in a couple of months' time, we don't find any hospital where patients are being told that they can pay bribes. Bribes are being demanded, or patients are being diverted from public hospitals to private hospitals. So it's the actual change on the ground that will ultimately be the impact of the story. So that's what we are hoping for, and we hope not only just as journalists, but we all stakeholders working together, we can be able to bring that to forward. Yeah, I think those are the questions that I noted, and those are.
Thank you very much. There was a question here. Like I said, you had indicated that the corruption might have been influenced by the backlog of cases. Another example that I can give you is microfacial surgeons in Malawi. We only have 1. And currently we have close to 300 cases of those who want to undergo the microfacial surgery. And then that scenario can motivate or can influence corruption, because everyone wants to get to the first slot of the queue. Do you think this could be one of the reasons that might have influenced the corruption? And what should we do, in your opinion, what should we do as a country to address some of these issues?
So I'll invite my colleague Edith to respond, but before maybe she comes in, she's giving me, and I go ahead to continue responding, but I would say that I agree that there are a number of factors that contribute to corruption in the health sector. And number one is, we have a huge population now against a very small pool of health facilities. So the population boom is a major contributor factor to the situation, where we have put a lot of strain on very few health personnel to treat patients. I think our honorable member who is coming from the heavy background will talk about the patient doctor ratio in the country is one of the most alarming rates in the country. So that's one factor. The second factor is that generally the public service, and that includes the health service, people are underpaid. In other public service stations, people are able to go for trainings, allowances, workshops that constantly help them to be able to get additional allowances. There are parts, there are personnel, there's a personnel in the health service that do get allowances like locum, and those are able to, again, to be able to sustain their living. But there are others as well who do not have such kind of conditions of services that support them. So that again fuels corruption. Additionally, in one particular case like the Lions Department, there is a spike in terms of accidents in the city, and the Kabaza related accidents in particular have also made the backlog of cases in that facility, for example, very, very long. So again, for people to jump a queue, because of the backlog, they are forced to pay bribes. But the most important factor beyond everything else is that as a country, we are facing a cancer of corruption. And that does not have one sector that has been left untouched. So that's a general lapse of morals in the country that is leading to this, apart from conditions of service and the other factors that as mentioned.
Thank you very much. So you have mentioned the issues of population boom and the issues of HRH, human resources for health, being inadequate, being not enough to save the rapid growing population. What recommendations, therefore, are you putting forward to this committee? I recognize some of the recommendations that you have brought to this committee, but having this in mind, looking at the doctor-patient ratio, which is the most lowest in this part of SADC region, the dwindling resources going towards health sector now with the withdrawal of funding and the rapid growing population, I haven't seen the recommendation to that effect. What are you telling this committee?
Okay, quickly, Chairperson, Honorable Chairperson, and again I would defer to my colleague for this question because she had prepared a set of recommendations. But I think the most immediate recommendation to the committee, because of your oversight work, would be to ensure that the allocations to the health sector are reviewed and adjusted appropriately. Some of the issues are to do with personnel inadequacy and also conditions of services. So as a committee, you play a very critical role when it comes to that kind of allocation. Secondly, again to the committee specifically, would be to ensure that the committee is regularly monitoring the health facilities. Particularly, the committee should be focusing on the viability and the viability of the safeguards that we have put in place, the ombudsman, the internal controls, and ensure that those guardrails are working to protect ordinary Malawians. Additionally, we should also strengthen controlling officers' roles, the PSAs, because most of these things do sometimes end up reported to officers. But if controlling officers are not able to do their work, we'll keep changing the law, we'll keep changing the budgets, but someone has to do their job and ensure that their teams are adhering to the law. Because the Public Service Charter already has a lot of provisions that are supposed to ensure that people are doing their work within the framework, but nobody is enforcing those mechanisms, and we need to ensure that controlling officers are doing their job to enforce the law.
Thank you very much. And then there was a question that you never tackled, a question of from, I think, Mangochi West, where he had wanted to, you to clarify why did you leave out the health centers? And just to add on, how did you sample these health facilities? So I can see there's Rikoma, there's Chirazuro. What sampling mechanisms or what motivated the consortium members to sample these health facilities? Thank you very much. But before you can just take note of these questions, we have Mwanza West, then we go to Kotagota Nkula. From Kotagota Nkula, we go to Chewu Central East again, and then we go to Nzimba Perekezi before we hit the wise people of Chewu North. In that order, please.
Thank you so much, Chair. I just wanted to appreciate, after you reported the matter to the management of the health facilities, how many people were brought to action, because the longer we take, the more lives we are losing. And you have said in your presentation that corruption is a system. These people being reported to their disciplinary bodies by the management, like the Nurses Council, the Medical Council, and do you perhaps think that because you've said it's a system, the management might be trying to protect these individuals? And in your investigation, what cadres did you find to be more corrupt or more vulnerable of corruption, and how best can we present this? Because as a team, you're doing a good job, and this is your committee, as the chair has already said. Where do you think these matters are stuck, so that we can best help you as a committee, so that these people should be brought to justice, so that there is equity and justice in our country? Thank you.
So how many cadres were disciplined, and which of these cadres were taken to action? I'm not quite sure if you'll be able to tackle that one, because again, that is not your scope of work. We go to Kotagota Nkula.
Thank you, Chair, for granting the people of Kotagota Nkula to say a word or two. First of all, allow me to congratulate the consortium. You guys look youthful, and that hunger for patriotism is highly commended. Thank you so very much. So we are happy to have people like you in Malawi now. My first question is about your emotional readiness, because corruption always refuses to die. I'm sure if you haven't yet started receiving threats, but soon you will start receiving them. How ready are you? Are we not seeing this consortium dying a natural death after 2 or 3 threats? Number 2, this might be a benefit of coming in late. In case I ask a question that has already been clarified. I wanted to know the criteria that you follow in choosing who is going to be the member of the consortium from the media houses. And on the same, I want to know how democratic your organization is. Is it something that will be changing leadership every year, or is it political? Who do you choose to be on board? Thank you so much. I submit.
Thank you very much. Did you receive threats? How emotionally are you ready to manage the threats that will be coming along your way? And then the consortium members, is it a democratically instituted organization, or just handpicking? We go to Nzimba Perekezi.
Thank you, Chair. Can you provide comparative data? Can you please provide the comparative data showing the average waiting time for patients who paid bribes versus those who refused to pay the bribes? Thank you.
Thank you, Nzimba Perekezi, for that wonderful question. We go to the people of Chewu Central East.
Thank you, Chair, for recognizing the people of Chewu Central East. Mine is a comment on the corruption, especially at orthopedic center at Lions at KCH. In fact, we have specialists there. Just for your information, the specialists are not the ones who are doing the corruption. There are middlemen there. Middlemen, you may wonder, where are these middlemen coming from? Middlemen are the paramedics which are working together with the specialists. So these are the ones who are doing rampant corruption at Central Hospital at Lions. And indeed, this is true, and it is really happening, and it is nicknamed Mazim. These people, they're the ones who do enlist the theater list. They enlist the theater list to be done surgery by the specialists. Because the specialists, they don't go direct to the patients, but these paramedicals who work together with the specialists, they're indeed the ones who are doing this. And I've got evidence. If you can find me, I can give you the evidence. 20,000 was spent for a patient who was in the hospital for 1 month. But when he paid that 20,000, next day he was operated. Thank you.
Thank you very much. I think that was more of a tip. Members of the consortium I think you have a lot of work to do. And Shehu Central East is giving you a lot of tips to work on. Dowa West?
Thank you, Chair, for recognizing the people of Dowa West. Mine is a concern about corruption. Let us look, those who are coming from rural areas, they transferred from their health centers without anything in their hands. So if we allow that type of behavior, that means it hinders much to those who are needy ones. What's your way forward to help those ones? Thank you, Chair.
Thank you very much, consortium members. Those are the questions. Some are the tips. Take them on board. Over to you.
Thank you so much, Chairperson, and thank you so much, members of the committee, for the specific questions. The first question, what motivated the selection of the hospitals that we focused on? Number one, I think it was to do with proximity. We wanted to manage the few resources that we had, so we had to identify hospitals that were closer to us. So I think that's the one reason why we chose the central hospitals and also the district hospitals that we referred to. Secondly, it was also to do with the capacity of the health facilities. KCH, Queens, Zuzu Central have big capacity, so they support many Malawians. So if, in order for us to tell the impact of corruption in the health sector, we had to look at which facilities are interfacing with more Malawians on a daily basis. So that informed our decision to focus on the central hospitals and the district hospitals. But we also wanted to be as reflective of the society as possible. So we had to at least choose a few districts outside the main centers of the cities and to see also what is happening. That's why we selected Ilikoma, where we knew that there isn't much focus on it. It's a very remote place, and we can be able to say if these things are happening at Ilikoma District Hospital and are happening at Queens, then they are happening across the country. So that was part of the decision making when it comes to selection of a hospital. But importantly, it was about resources. We only had limited resources, so we had to be creative and trying to sample a few hospitals that we could be able to afford with the team that we had. How many people have been brought to action so far? We don't know. Honorable members, we have to confess here, we don't know at this stage how many people have been disciplined because of the story that we covered. And hopefully we'll be able to follow up and find out how many people were disciplined based on the story. How many people have been, how are people being reported to the medical council? We are not aware, again, if people have been reported to the medical council directly based on this story, but we are aware that the medical council has disciplined several healthy officers subsequent to this investigation. But we don't know the origins of those disciplinary actions. We might make an assumption here that it was because of the story, but I think we need to critically investigate, find out from the medical council, to find out what were the reasons why those people were disciplined. But we are for a variety of cases, some related to these issues, some to other cases like physical abuse of patients, so others about drug theft. So we shouldn't make assumptions, but we can find out if anyone was disciplined or sanctioned based on the findings of investigations. Honorable Representative from Nkhotakota Nkula, thank you very much for your kind statements about the work that we are doing. We appreciate that. In terms of your question, in terms of our readiness to do investigative work, honorable member, you might think we are young, but we have been around in terms of journalism. I've practiced as an investigative journalist for the past maybe 8 years. I've worked as a journalist in Malawi for 18 years. So yes, we are relatively young, but I think we are very determined to do the job that we do, and we are very passionate about this work. I've only known journalism as my work, so this is the job that we do with a passion. So thanks so much for the kind words, but we are really geared as the media houses, as the members of the CJE to do this particular work. Just a reminder that the consortium is made up of different news organizations. Some of the organizations, for example, like Nation, has been in existence now for 25, 30 years. Yeah, so you find that within Nation Publications Limited, there are editors who have worked at Nation during all that period from the beginning up to now. So they have accumulated a lot of experience in covering investigations. There are editors who covered the Mwanza murder investigation, who broke that story. Up to now are still practicing journalism. So we draw inspiration, but also expertise and the experience from those who have practiced for a long time to also lead us along the way. So we are determined to do this work. At BIJ, for example, we are solely invested in investigative journalism. We don't do any sort of reporting. We don't come to Parliament to report on the budget. We are only doing investigation. So we are very determined to do investigation. So yes, we are emotionally ready. We have been trained in this to do investigations. And just to add, Honourable Minister, to utilize the Honourable Chairperson, rather, to utilize this committee's hearing, the investigative journalism is not something that we do lightly. It has consequences. It has consequences not only investigative journalists, but also the people we report on. It's a very important undertaking. We need to help the country, but we shouldn't use it again as just to persecute people. So as trained investigative journalists, we know we have platforms, we know we have power to make or break people, but we also are aware of our responsibilities. So when we are doing this job, as professionals, one of the things that we are mindful of, that we are not doing anything out of malice. So the committee and the House can be assured that as investigative journalists, we are professional enough to recognize that we do this job to support our democracy and our national building, but not just to bring down people. I think that is very important, because with the rise of social media, there is sometimes unrealistic expectations placed on the journalism. Our job is not just to name and shame people without evidence. We should name and shame people when we have evidence. I think there is tremendous desire, hunger for Malawians to know the truth about corruption, but that should be done in a systematic way, and that should be done with evidence, and that's very crucial for our democracy. Yeah. I think I wanted to make that addition because I know people have a lot of expectations on journalism, but it's not just our job to present information that everybody has given us. Our job is to investigate, make sure that the only information that we are bringing to the public is information that we can be able to defend in a court of law. So that's the job that we have. So sometimes we will know things, but will not be able to publish, but sometimes we'll publish things when we have enough information. But that's a commitment that we do make, that we are going to look into everything. Yeah.
Thank you very much. Times Group.
Yeah, I just wanted to comment what Gordon has said about the criteria we use to become investigative journalists in Malawi. It's not that everyone can become an investigative journalist. It's a passion. And somebody has to have that passion. And we are not here investigators just because we want to, but we have chosen this path to bring change in the country. Thank you so much.
Thank you very much. NPL?
Yeah, I think I just wanted to weigh in on the issue of what disciplinary measures have been taken for the people that may have been found to be in the wrong. I think this is one of the issues that this report highlighted. If you read the story that was published, you will see that when we spoke to the ministry, we spoke to the principal secretary. He acknowledged being aware of the problem. And I think he blamed it on professional ethics of the people involved. We spoke to the Office of the Ombudsman. She said just in the year 2025, over 16,000 cases were recorded with her office. And we also spoke to some health rights authorities, Malawi Health Equity Network. All of these people, you will see the common thread is that they are aware of this problem. So maybe the question is, why is nothing being done? If you're talking of a PS, that's a high-level office in the ministry. They are aware of this problem, but they're not doing it. So I think, just to agree with what he said, the committee now has to step in and provide oversight. One of the concerns that came out were that the patients appeared to be reluctant to report the problems because of fear of retaliation. And also, most of these are community members that will have to go back to the same health facility if they were to get sick again. And if they report their health official for being corrupt, it means they may not get the support. But we do know that the hospital ombudsman facility is there, but it's not being utilized, or it's not being effective. So why is it not being effective? Hence the need for oversight. So I think there's a big role for the committee to come in, and I think it's very encouraging that you've taken this issue up seriously to start this inquiry. And I think, given the sentiments that have come from the panel, it's also important that you work along with the media. I think you can start with the consortium itself, which has experience and it has broken this story, and see how far we can go together to expose further the other underlying issues that are continuing to happen, but also to ensure that this matter comes to a close. Thank you.
Thank you very much. Another final set of questions, if we have. The people of, the wise people of Winchell North? No question? Right. Do you have more questions? Right. In Zimbabwe, Rekezi?
Mine has not been talked here.
Oh, here.
The one on the waiting. Data. Yeah. So, I mean, I can give an example of the experience that some of the reporters had at Queen Elizabeth Hospital. So it so happened that one of the undercover journalists that did the story from the Queen Elizabeth Central Hospital was there for about 3 days. And within those days, he was able to see there was a specific case of a woman who had come in for a tooth extraction, and she wasn't able to get it done because her blood pressure was up. And so she was sent to go and have her blood pressure attended to, and she waited for 2 days because she couldn't bribe anyone. And one of the people that were on the queue was able to pay 10,000 and immediately got access to support from the health workers. And she was desperate to get assisted, but she didn't have anything. She had been referred from Lunzu to Queens. And you can imagine she spent on transport, she was in deep pain with a toothache, but she didn't have anything. So I think we also indicated in the story that the reporter had to help with the 10,000 kwacha that was being demanded. And the moment that she paid that amount, she was able to get access to treatment immediately. So it's that sharp, immediate to 2-3 days waiting because you haven't paid anything. Thank you.
Thank you very much. If there are no more questions, observations, and comments, may I humbly the consortium member to give us your concluding remarks.
Thank you so much, Chairperson. Let me once again thank this committee for inviting us to avail ourselves to this session. We really appreciate the interest that the committee has taken in the week that we published, and we have taken note of all the suggestions, the tips that we have received from honorable members this morning. We look forward to working with the committee and availing ourselves for any information that you may want. As an area endeavored, we will provide the evidence that we have secured to this committee, and we look forward to the recommendations of the committee subsequently. I think there was one question that we skipped from Nkhotakota. Honorable member asked whether this committee is a political organization or this consortium is a political organization, or what is the criteria for the selection of its members. This is a non-partisan organization. We are not registered formally as an organization. We started as a project as part of the support to the law enforcement agencies under the TSOC project by the British High Commission. We are members from various media organizations, standard organizations, Nation, Times, and other Zodiac, but we've decided to work together because of the desire to support this country. So we do work loosely, but we'll be working together from time to time. So we do not have any political agenda per se. We are just interested in supporting Malawi, and we look forward to engaging the committee in the future. Thank you so much, honorable members.
Thank you very much, the consortium members, and thank you very much, honorable members, for the questions, comments, and observations. I would like, on behalf of the committee, sincerely thank you for availing yourself before this committee. This is your committee, and we have a lot of work that we need to undertake as a committee, and just like you said, we also do not want to preempt what we want to do, but what we can emphatically say here is that we need to work with you. We need to collaborate, because some of the projects that we need to do need collaboration, especially with you as consortium members, but of course as also individual media organizations. Thank you very much again for the recommendations. As a committee, we are taking this forward, and where possible, we'll be also engaging you on the same matters just to strengthen the report that we'll be producing. Thank you very much. And we would like to have the evidence as soon as possible, so that when we are compiling our report, that should also be part of the report. Thank you very much. May God bless you. Thank you very much.